Hello and welcome to the third episode in this series of podcasts from the Coalition for Life Course Immunisation, the CLCI. My name is Gary Finnegan. I'm a health journalist and editor of Vaccines Today and also a trustee of the CLCI. This series explores how to make life course immunisation a reality in Europe. And the CLCI has published a manifesto setting out the steps that need to be taken to make this reality in Europe and to protect people of all ages against vaccine-preventable diseases. Developing good data is essential to making evidence-based vaccine policy choices. So today we're joined by Lotte Steuten, who's Deputy Chief Executive at the Office of Health Economics, to discuss the socio-economic value of vaccines and how to measure it. Lotte, you're very welcome to the podcast. Thanks for joining.
Thank you so much, Gary.
So you recently published a very interesting report on the value of vaccination, adult immunisation in particular. Could you tell us a little bit about this report, what you did, and the key findings, please?
Yes, of course. So this report really presents the results of a very comprehensive analysis of adult vaccination programs that was done by the Office of Health Economics and was commissioned by the IFPMA. And we looked in this report at 4 adult vaccination programs across 10 countries, and we tried to determine the impact of these vaccination programs on the health of individuals, on the healthcare system, and also on society more broadly. So, because it was such a complex or comprehensive report, we focused on vaccines that really protect against influenza, pneumococcal disease, RSV, and herpes zoster. And the research really looks at the delivery of those vaccination programs in 10 countries that really range quite a bit in terms of the healthcare systems that they have, the demographics, vaccine schedules. So we've got countries like Australia, Brazil, France, but also, for example, South Africa, Thailand, United States, Germany, Italy, Japan, and Poland, if I'm correct. I hope these were 10. So these ultimately, sort of after all that research, the report really concludes that the vaccination programs provide very substantial returns on investment in 3 different ways. So they provide value to individuals by, to some extent, saving lives, depending on what vaccinations we're looking at, but also by preventing serious disease, for example, in the case of herpes zoster. They also provide lots of value to the healthcare system. They reduce doctor and hospital visits, for example, and that means that those resources can be used for different patients. And thirdly, they also contribute to society by allowing a healthy and active workforce to be active throughout life, which can really help boost economic productivity.
Okay, wow. So a lot there, and as you said, 10 countries. Not they're not all developing and not all rich countries necessarily. You know, Brazil, Thailand, South Africa, and obviously European countries too. So, did you find in that spread of countries different results? I think the headline was a 19-fold return on investment, but is it different from one country to another when you looked?
Yeah, that's a very great question, and there's not a straightforward answer, I have to say. So we indeed deliberately included a very broad mix of those programs as well as countries to really investigate to what extent they would pay off across this broad range of context. And so the good news, I think, from our report is that there was absolutely the case. So we found positive return on investment. Of course, that differed depending on the program and depending on the countries, but they were all positive across the board. Um, and sort of the bad news, if you like, is that as a result of this sort of very broad mix of countries as well as programs, there was no clear best practice or silver bullet that we can say, like, this is the one sort of key element that you have to nail and then everything will be fine. Really, the results depend on multiple factors. For example, like how common is the disease, what is the basically underlying disease burden, how effective or efficient are healthcare systems currently in treating those conditions, etc. But as I said, basically the results show that by implementing adult value vaccinations, you can hardly go wrong, at least from an health economic perspective.
And as a non-health economist, maybe you could just tell us the most fundamental way of valuing these vaccines. So I guess it's not as simple as how much is the vaccine and how much is saved from one person. Do you have to calculate how many people would have gotten the disease otherwise, or how many you have to vaccinate to have the impact? What do you do? But treat me like an absolute non-expert, please.
Okay, so basically how we approach this, it's not that far off from the way that you're describing it. So that's a really good start. So indeed, the report showed that these vaccination programs can return up to 19 times their initial investment. And we arrived at that number by, first of all, looking what are the costs of these vaccination programs. So looking at the vaccinations themselves, but also the time that people need to take to get the vaccination, and also potentially any side effects they would have that might need some treatment or maybe just some productivity loss because of that. Then the other side of the equation is really what are the benefits that are generated, and these are basically the benefits in terms of potential mortality avoided. So from some of these conditions like flu, RSV, etc., pneumococcal, people can actually die. So we looked at what is the value to society of saving a life, essentially. We also looked at the value of preventing disease and illness, so morbidity. So, what are the costs of people that have to be treated either in the hospital, in primary care, or just self care at home, etc. And then the third bucket is like, what's the impact of having these conditions on people's productivity, um, both formal as well as informal productivity. So basically, when we had the cost on one side and the benefits quantified at the other end, we divided those over each other, and that gives you the return on investment.
Okay, well, interesting. So I suppose, I mean, mortality, those data are so clear, and if people miss working days, perhaps it's a little bit easier to calculate. But how about things like, as you said, productivity? Someone who gets shingles or flu and is just a bit below below par for a while. I've seen a case of shingles in my own family, and there was an impact that went on and on. Is it difficult to calculate to capture those impacts?
So for this study, we heavily relied on the published literature in this space. So there are studies done for about the productivity impact, and indeed that is looking at the number of days in work lost fully, but also sometimes people uh, uh, um, can be working, but are less productive while they're working, for example. So that's called presenteeism. So you're still there, but you're just a little bit, less effective than you would normally be. So we based our estimates on the published literature that really estimated like what's the impact of those diseases. It's important to note that we also found that those productivity elements are still very hard to get by. Not for all diseases have these been published, and especially not for every specific country. So this is definitely an aspect that we underestimated in our analysis, simply because the data is still very, very scarce.
Interesting. So I guess that some of the big policy lessons to come to in a few moments are, about vaccine programs and government policies. But just as you're describing that, it makes me want to ask, what about employers? Is there a strong incentive for employers to encourage or to facilitate somehow, access to flu vaccination or even time off or whatever it takes?
If we look at the results of these type of analysis, we do see indeed that, particularly for those diseases that are quite infectious, there might be a good incentive for employers to sort of provide vaccinations to their workforce to sort of help them not getting ill and therefore being more productive at work. So there's definitely a case to be made that would be a good investment for the employer as well. So yeah.
Okay, and for health systems, you mentioned at the beginning, I think we can all imagine the winter impact of flu and pneumococcal COVID. Um, is this something that you think people appreciate now in a way that they didn't a few years ago, or is that message still getting through to the public and policymakers?
Um, I think the message is coming through to the policymakers for sure, particularly people working in in the health force who has sort of relatively frequent interactions with the healthcare system. That yes, there are quite long waiting lists in many countries still after the pandemic. That where all health systems in the world are sort of grappling with that. Then on top of that, we see of course like these surges of like infectious diseases that need like urgent treatment when the symptoms are so severe that people would need to be hospitalized. So I think that sort of realization is very much there. I think also what we see like after the pandemic, so much focus has been on COVID-19, obviously, but also other conditions, other infectious diseases. That there's also maybe potentially a risk that people feel a little bit, tired of hearing about infectious diseases over and over again. But nevertheless, particularly now in these times, it is super important to sort of have robust prevention programs, including vaccination programs, but also other interventions, obviously, to make sure that people do not unnecessarily, between quotation marks, have to go to the hospital or their primary care physician, for example. Yeah.
Okay. And as populations are aging, which they are in Europe and in most of the world, and chronic diseases rates are rising, um, is it possible that if we calculated these things in 5 years' time, that the impact would be even higher than 19 times return on investment?
Um, Possible. I always try to stay away from those speculations. So I would like to see the research first. But indeed, like sort of logically thinking, we're looking at indeed aging populations, and with age, our immune systems do not get much stronger. So the risk for getting an infectious disease and also the symptoms potentially will be likely be more severe in aging populations. And the same goes for people who have underlying conditions such as chronic diseases. So seeing those sort of both sort of combined increase, it is indeed logical to sort of expect that the value of adult immunizations will not go down anytime soon. And therefore, it is really important we get those programs basically funded for, implemented in many countries, such that we are basically prepared and keep our populations as productive and healthy as possible, really.
And I think you did warn us at the beginning. There's no magic solution that everyone can copy paste into their policy mix. But are there? I'll ask you anyway. Are there examples from countries who maybe began this a little earlier than others and are seeing the benefits? And maybe in contrast, naming or not naming, that there are those who are a bit slow to get on with adult immunization.
Yeah, so maybe as one example, we did see, for example, we do see that the adult RSV vaccinations, these are this is like an emerging vaccination program. Those vaccines have not been around for as long as the flu vaccines, for example. And we do indeed see a great value from those countries in our analysis, where we had data available about their implementation already, which were Germany and the US. So other countries are sort of following suit now and thinking about the implementation of those programs. Indeed, we do see like there's definitely examples of countries that are basically sort of um, are a bit of a front runner, if you see if you like in implementing those more novel vaccines. Nevertheless, clearly, like we said in the beginning, we had a very broad mix of countries, also with differences in terms of their ability to pay and implement, etc. So it's not more than logical that we would see some of those differences. But we can, of course, try and take some learnings from those countries that are already sort of starting this. And I think what we also see, there's a very full pipeline of vaccinations coming to the market, including some combination vaccinations potentially, which could be more efficient. For example, if you would have to go get a jab and you get one for flu and COVID-19 combined, for example, or whatever combination, I can see sort of there would be some efficiency gains for that as well.
Okay, interesting. And this prevention first mindset that you mentioned in your recommendations of this report, is that something? Is that a way of presenting vaccines as part of a wider mix of prevention? So getting people moving more and eating better and not smoking and all of that. Um, is this something that you think could capture the public imagination as well as policymakers?
Yes, absolutely. Prevention is really, really key, of course. But I think the challenge with prevention is um, policymakers, healthcare specialists, everyone have been saying that for years. It's also very, very hard to do, right? To some extent, if you're sort of going to be sort of making a bit of a broader comparison, to some extent, if we see the rising cost of our healthcare systems, that is in part basically the price we're paying for not having better prevention programs, right? But nevertheless, prevention maybe is not as sexy, if you like, than some of the other new therapies, and therefore it is always sort of hard to sort of get this balance right. We need both. We need, acute treatments, etc. But prevention is really critical. I think with vaccines, of course, compared to some of the lifestyle interventions, which is very, very hard to do for populations as well. With vaccines, of course, that is something that the healthcare system can be set up for. It's relatively relatively easy to sort of maybe go and get a vaccination. Of course, depending on where you live and your access to the actual healthcare system is very critical, but that is something that can be arranged with the proper policy as well as funding in that extent. So it's definitely part of a broader agenda that should be focused on prevention. Yeah.
And in terms of value or return on investment, so I suppose you evaluate other health technologies or even other technologies or other possible investments. How does this 19-fold return compare to some other medical device or even things like primary education, which is always seen as a big can really pay countries back very well? Is 19 times a lot? It sounds like a lot, but maybe
Mhm.
you could tell us how it fits into that wider scheme.
Yeah, so 19 definitely is a very substantial return on investment. There's a couple of comparisons, of course, that can be made. If you think about sort of prevention and vaccination in general, tends to have very high return on investment outcomes compared to some of the other of the more acute treatments, for example. Um, Again, if you sort of want to compare very, very broadly, I think prevention comes out relatively high, including adult vaccination. I think people are more used to thinking about, children's vaccination programs. And of course, because we are doing this in a very early age, there's a very long time across the full lifetime of a person to reap the benefits, if you like. But we were actually quite surprised to see how high adult vaccination, how close it really came to also pediatric vaccination programs. And I think that really has to do again with the aging societies and the fact that we also looked at productivity to the best extent possible with the data available, because it really is an important driving factor of the value of adult vaccination programs as well.
Interesting. Okay. And when you see some of these numbers, I suppose someone from the outside would ask, why isn't this normal everywhere? Why doesn't everyone prioritize prevention of all things? It may be too big a question to try and tackle in a podcast, but what are the barriers or the structures that are in place that make it difficult to move from kind of a treatment-based system to a prevention-based approach?
So I think it's quite sort of natural to most people to focus on like the very urgent programs when they are in front of you. I think we have seen a response to the pandemic of that was because it was such a big problem that's very urgent, which is much quicker than to some of the other infectious diseases that were not as big as the pandemic, but every year we see like very high numbers of flu cases, RSV, etc. So I think there's always a bit of the tyranny of the urgency, if you like, and I think that is simply how people are sort of mentally wired in some way. And of course, there's also like multiple demands on policymakers, decisions that have to be made. There's also limited funds in healthcare systems, no matter how you look at this. I think for quite a long time, we have sort of gotten used to the fact that, yes, there were good vaccination programs, particularly for children. The uptake was good, and everyone seemed to be feeling like, okay, we're doing pretty well in this area. And it was definitely the case in many countries. Clearly, there's, measles, for example, is coming back, and there's many infectious diseases around the world, particularly in lower income countries, where a lot of work has to be done. I think in the sort of middle to higher income countries, that seem to be less of an urgency, but we clearly see now with the rising number of infectious diseases, etc., that it really is important. So we are hoping that this report helps to create the awareness about how large is the burden of infectious diseases, and also what is the value of providing vaccination programs as part of a broader prevention agenda.
And can I ask you, this is maybe a question back to the beginning, in terms of evaluating the impact of the vaccination programs, is it evaluating the impact on the programs as they are now, given the level of uptake that exists, or is it the ideal program where everyone has the vaccine?
So this was really looking to the vaccination programs with the estimates of uptake that we have currently available. So basically, it's how they're currently being rolled out compared to not having these programs available. So that's a very important question. This was not like some ideal scenario. What if everyone got sort of jabbed and uptake was perfect? So we basically looked at the current uptake rates. So indeed, increasing uptake would provide different and better results indeed. Yeah.
Okay, good. Because I mean, without getting into all the data, some of them are pretty low for some vaccines in some countries. So yeah, I guess there is even more benefit to be unlocked, as they say.
Yes, absolutely, fully agree. Yeah.
On gaps in the data, I think one of the recommendations was to try and address some of the gaps that you uncovered in doing the research. Could you first of all tell us what gaps we need to fill, and then how might these be addressed?
So there were basically, I think, 3 to 4 sort of main gaps. Um, I already mentioned the data around productivity value of vaccination programs, and sort of there's a couple of reasons. First of all, measuring productivity is not always as straightforward, particularly when you look into productivity while people are actually working. Like counting workdays lost is one thing, but the sort of further productivity, but also productivity for people who are not in the labor force anymore, but have uh, a a productive contribution to society, for example, by volunteering, watching after their grandchildren, taking care of their partners, etc. So that's also an important element of productivity in society. So those data are really sort of need some further work. The other bit is the impact of vaccinations on social equity. What is the value in different parts of the population? Some of the more underserved parts of the population actually see an even greater value of vaccinations, because if you happen to have to take off time from work, or when you get ill, when you are already in like a sort of underserved or like more difficult economic situation, that impact is even bigger than for some other people, right? As you can imagine. So that's an important one. But again, data on that have not been collected more broadly. Another big concern in our societies is antimicrobial resistance. Vaccines can help if you do not get pneumococcal disease and not other infections related to that. You don't need antibiotics, for example. So there's also sort of this indirect effect. And there's lots of focus on antimicrobial resistance and the role of vaccines, but that's basically still a bit of an emerging field and has not been fully captured within the literature. There's also another reason for that. Not all countries that evaluate those vaccines take those broader values into account by when they are making a decision about whether or not to implement these programs and also how much to pay for a vaccine. So, for example, for the developers, there's not that much incentive to actually go and collect those data because there will be no impact of those results on the actual decisions. And I think that's an important call for policymakers and decision makers in healthcare systems, that particularly for adult vaccination programs, much of the value is generated beyond the individual being vaccinated and even beyond the healthcare system, but really falls on society. And by sort of not including those, we're actually really underestimating and sort of missing a big part of the picture, which is really important for other parts of the economy.
Okay, interesting. But when you found the results that you found in your report, were you surprised at all at how high it was? In the sense that I think I saw one from Gavi about developing and mid sort of developing and post-developing countries, which was about 16-fold or something. But
Mhm.
those were obviously those were quite poor countries, and if people missed work, that was possibly it for the family and so on. But in developed societies, in the European and Australia and Japan that you looked at, it still seemed very high. Was this what you expected, or not?
So it's also, I mean, yes and no. So the way we did the analysis, like there's different ways. This gets a little bit technical. There's different ways to sort of value, for example, um, let's say, to quantify the value of a life saved, to quantify the value of preventing illness, for example. So the up to 19 value is basically using the most commonly used approach for that. And that's also the approach that happens to give relatively higher results compared to other approaches. So we've also in the report detailed what the results would be with the other approaches. And again, sort of the most important message from my perspective really is that no matter what approach we use, so the one that generated the 19, which was obviously going to be then the headline, as you can imagine, but also the other approaches led to very positive return on investment. So we're seeing a band between, let's say, 5 and 19, and in some countries even higher than the actual 19. So, but I think from my perspective as a researcher, the most positive, the most important message is it's going to be positive, right? And the more positive, the better. But same as we don't necessarily decide to sort of we're only going to focus on one disease because that has the highest return on investment. We have multiple conditions that we have to provide prevention and treatment for. And all of these are therefore, a good value.
And of course, we are talking in very economic terms about
Yeah,
numbers and so on. And in terms of investment in roads or something, this one
yeah,
will save lives and keep
yeah,
people healthy. Um,
definitely.
so, in terms of globally thinking again on the impact, do vaccines also contribute to some of the shared UN development goals that everyone has signed up to?
Yes, indeed. So there's, as I think maybe many people know, there's many sustainable development goals that the United Nations have published. I think there's about 17 in total. So there's basically sort of three that I can sort of mention where adult vaccination programs provide direct value to. And the first one is the first one of these goals is to ensure healthy lives and promote well-being for all at all ages. I think we've sort of extensively discussed how adult vaccinations contribute to that. And the second one, the second goal that I would like to call out here is um, that basically facilitating full and productive employment also supports sustainable economic growth, and that's another United Nations goal. And the third one is helping to reduce inequalities. And again, as I said before, vaccination programs can be, helping to sort of equalize indeed a little bit, of some of those inequalities that we see in our societies.
And on the inequality one, well, I'm saying this anecdotally, which you won't appreciate very much, but I think older people with the resources to do it will often pay privately, even if something is not covered by the
Mhm.
public system. And then
Mhm.
there's also just the opportunity or the awareness to go and do it.
Yeah.
How big a factor is that inequality, social inequality, economic inequality?
Yeah, so that is a very important factor, and therefore I think it's really important that healthcare systems and policymakers make good effort to make sure that everyone has access to vaccination. Because once people do, particularly people who, like we discussed before, where the impact might be economically sort of more difficult to absorb than for other parts of our societies, that would really be a very important element. So thinking about how can we make sure that people can actually more easily access, like maybe going to getting your vaccination from a pharmacist rather than having to go to your GP, if that happens to be like closer by or has like more flexible opening hours, etc. So I think there's definitely ways we can think about how to sort of provide access and make sure that it is more equal, and indeed, of course, making sure there's funding for that, such that not only people who can afford it out of pocket have access. Yeah.
Okay. On the data question again, just to circle back to that, I've read some things recently about, when people have vaccines in different places. You mentioned pharmacy, where I had my own flu vaccine last year, and other places that sometimes the data is not well connected, or it's not
Mhm.
easy to know very simply this is how many people over 65 had flu vaccines, which is a really specific target, and that's before you get to shingles and other things.
Yeah.
So is this something that really needs to be addressed across all the countries that you looked at, or has anyone really nailed this?
Very good question. I do not have like a very precise answer on that. We've been doing some work within the UK, looking indeed at access to pharmacies versus GPs, and like how big of an impact that could potentially have in terms of uptake, etc., and the impact also on outcomes and also inequalities. It is really hard to get those numbers because these are basically separate parts of the system in some way, and also the data is not like easily available to sort of clearly see what is happening, and even understanding how many vaccinations are delivered by whom, and well, by which of the parts of the healthcare system, etc. So that's definitely something that would need further work to be able to give more concrete advice as well, and do better research on that.
Okay, great. We're coming towards the end, but I was wondering when I was reading through some of the reports, what kind of reaction you've had to it in general, especially from the policy making world.
Um, so there's been a great interest in this report so far. So that basically sort of, I think sort of the people that we interact with are very sort of pleased to see the results because it's such a comprehensive study, and also looking at in the more details of the report, like what was captured and what was not captured, and also thinking around how we can improve the actual evidence part. So I think people have been sort of very sort of welcoming of the results. Of course, it's quite early to tell what they will do with it. The report has just been published, basically, I think a month or so ago, just before the vaccination week. We have had a number of engagements with senior health people, policymakers around the world. So also we're going to the World Health Alliance meeting in Geneva next week, where we will be presenting those results as well. So yes, well, we are very sort of hopeful that this will have a very good impact. But yes, that is yet to be seen.
And what is your one big message for policymakers when they call or if they listen to what you have to say? What's the take home?
So the take-home message really is that prevention first mindset is really necessary, and that adult vaccination programs are a critical building block of that. So implementing and optimizing these in a robust way is really important. Also a need to expand and develop the evidence base. But I guess sort of the one-liner is, investing in those programs, you can hardly go wrong. I mean, no matter how we looked at the data, from very optimistic to very conservative, with a very conservative perspective on the actual inputs, etc., and all the nitty-gritty details, it's really hard to get those numbers to something that would not be good value. And I think that is a very important message to almost any way of doing this would be basically paying off for societies as a whole, for healthcare systems, and most importantly for the individuals themselves.
Brilliant. Thank you so much for that. I think I hope everyone reads the report. Anyone who reads it can't possibly think of vaccines as a cost after they read it. It's purely an investment that pays. But thanks so much for joining and explaining all that to us. You can read the report on the OHE site. Don't forget to join us next month when we'll be putting the spotlight on vaccination as a societal good. So subscribe and make sure you get the episode wherever it is you get your podcasts or on YouTube. But for the moment, thank you very much, Lotte, and thanks everyone for staying with us.
Thanks, Gary.